Hey, it's Patty. This is part of a 4 presentation series on glial cells and neurological presentation and connective tissue disorders. And it's going to be as complicated as it sounds. So I broke it up into 4 pieces. I'm leaving the science in because this is, I feel like this should be commonly known stuff. This is just science. I did not make this up. It is not my opinion. So I'm leaving the science in, so whoever would like to go back and reference or look into it and expand on it, please do, right? So it is heavy on the science because I just haven't seen the information put together in other areas. So I want to keep it rich with really the scientific proof and background and neuroanatomy and all of that that is going to help support why I'm giving this presentation on the importance of glial cell activity and the changes in neurological tissue structures and barriers with a connective tissue pathology. So this first presentation is really going to be on understanding um, what I'm talking about from, I won't say a healthy standpoint, but without pathology or a disorder present. What are glial cells? What's the basement membrane of the brain? Like, why are these all important? And then we're going to apply that later on to connective tissue pathologies, and then specifically the neurological pathologies that we see, and then eventually into treatment strategies. It is so imperative that we understand the science behind it before jumping into the treatment strategies. So I know a lot of people just want to know how to fix it, but the fixing it is really through somebody's personal story as to how they ended up with the neurological presentation. As you'll see through starting to understand some of the science, it's unique to the individual. The risk factors are similar with a connective tissue pathology, but how somebody gets from point A to a diagnosis is going to be unique to their condition. So we're going to start at the extracellular matrix, and I am going to work through some of this pretty quickly, and the science is here to be able to refer back to look up, to expand on. But I want to get into some of the neurological stuff and really get into some more detail there. So the extracellular matrix, hitting the rewind button a little bit to understand connective tissue, is that 3D structure that surrounds our cells. It's where everything happens in the body. All of our cellular processes happen within the 3D matrix of the extracellular matrix. There's a bunch of proteins, polysaccharides, things like that. So these different components, like ingredients in a recipe, determine with their ratios what the product is you're going to see after you finish with the recipe, right? So depending on your ratio of collagen to elastin to other proteins, you might be looking at a ligament versus a tendon, but it's all extracellular matrix, right? So we need this strong foundational extracellular matrix that is built the strong functional way so that things are passing through freely, and all of these cellular processes are happening without incident. However, when we have a collagen problem, collagen is what helps. It's like the scaffolding of a building or a skyscraper. So collagen helps form and solidify the 3D nature of that structure. It's really like the backbone to everything. So if we don't have efficiency in our collagen, we could lose efficiency in the extracellular matrix, which is going to make it more difficult for cellular processes to happen. Okay. And Ehlers-Danlos syndromes and other connective tissue pathologies are considered dysfunction of this extracellular matrix. That's kind of the umbrella term, actually, is extracellular matrix dysfunction and connective tissue pathologies. And then we have all of these different ones that are within it. Um, the 3D structure that is supposed to be maintaining efficiency of this filtering system and cellular process that's happening through this area is impaired when you have a connective tissue pathology, whether it's collagen or proteoglycans that are in there, zinc transporter chains, different proteins. If you have an issue with the structure itself, then our filter system is not going to be as efficient in allowing all of these processes to happen, right? So it's going to affect that cellular functioning within the matrix and everything that happens at that level. So that's why I would say connective tissue disorders are so much more than joint problems. And we'll talk about the inflammatory piece a little bit through the neurology talk that I'll be doing in these 4 lectures. But that is, once you add the inflammation to somebody with a connective tissue pathology, that's where we see progression and things breaking down, is because your filter system isn't that great at filtering out this inflammation or toxins or whatever it might be. So we end up with these chronic progressive disorders, coexisting conditions. But if we learn how to properly care for these filtering systems or the extracellular matrix that was born a little bit differently, then we can give somebody the tools to actually be able to clean it out and then hopefully maintain it and bring things into remission, right? So we're going to talk a little bit more specifically about neurological tissue and the extracellular matrix. And this is where, I giggle a little bit now when I started as an orthopedic specialist in connective tissue pathologies. And after so many things not working, it's funny because I'm a visceral and a neurological specialist, and I never saw it coming. But that's because if you want to specialize in connective tissue, you have to realize that it's in all different tissues of the body, including your neurological tissue. So the brain has its own extracellular matrix, the interstitial matrix. Okay, this has its own recipe of different ingredients. It also has a basement membrane. So this is really important to understand because the structure also will be impaired in the extracellular matrix and the basement membrane, the blood barrier, all of those things, because there's an extracellular matrix dysfunction. So again, our neurological tissue might not be as efficient as taking care of things, which we'll talk about, as tissue that doesn't have a connective tissue problem, right? So the basement membrane, we'll have some pictures going through, very confusing pictures, don't worry. The basement membrane carries out a structural purpose, right? So it's protective in nature, and barrier functions. So this is where it helps to communicate and signal with the brain, but it's also very protective in keeping things out, right? It's a thin sheet-like composition of the extracellular matrix, and there are extracellular matrix molecules that are on what we call the peel surface. So that's between the gray matter of the brain and the cerebrospinal fluid, and then around the parenchymal vasculature, which is the blood supply to the brain tissue as well. So there's a lot of barrier formation that happens with connective tissue in the neurological system. So don't worry, I have a lot of confusing looking pictures, but this is just to show like, hey, it's me, it's in the science out there. We know this is brain extracellular matrix and the different synapses. So just to show you in the middle there, you can see extracellular matrix. So this is obviously a representation of all the things that it interacts with. But if you look there on the bottom left, there's an astroglial presynaptic sheath, and on the right, microglial process. So basically, this is just to show you like there's communication that happens with this brain extracellular matrix with astrocytes and with microglia, which is what we're going to expand on. And this is really important to understand the astrocyte and microglia problem to understand how to help somebody. Like I said before, we have all these different barriers of the brain. There's multiple different types of barriers, and just like other tissue in the body, what it's composed of is a little bit different depending on what its functions are. And if you have an abnormality in part of the ingredients to your recipe, you can have an abnormality in the barrier of the brain itself, right? So just important to understand that depending on which layers we're looking at, because we want to keep everything separate, right? We don't want blood materials to get into neurological tissue, because then we have neuroimmune reactions, which actually a lot of us are experiencing, but they're not supposed to. So just to show you, there are different layers. Blood-brain barrier keeps the blood and the brain separate. We have this arachnoid barrier, choroid plexus barrier, this brain cerebrospinal fluid barrier, and then more of the cerebrospinal fluid and choroid plexus, which is a little bit more of that CSF nature as well. But just to show you, for those that are always curious of why would inflammation have an effect on my cerebrospinal fluid production, it does, because it comes in direct contact with a barrier that is telling the cerebrospinal fluid how the external environment is and if it needs more help or less help. So there's always constant communication that we have to remember between connective tissue of the neurological system and all of the functioning that's happening inside. It's that feedback loop, right? Like that homeostasis. These astrocytes and microglia are constantly giving feedback as to if there's danger. It's like the mast cell of what we think of the rest of the body, right? And if there's misinterpretation or misfiring or an overabundance of the reactivity of those cells, which we'll get into, then you're going to have this abnormal neuroimmune response. Um, Here's just a close-up of the blood-brain barrier, just so you can see. But like everything else, it's made of stuff, right? And collagen is part of this, as are other basement membranes and things like that. You can see the arrow pointing to the glycocalyx there, which is kind of, it looks like that inner layer of the tube, or the space that's in there. Just something to remember. We're going to talk about the glycocalyx in just a little bit. And then the astrocyte end foot, you can see on the top there that it's pointing to. We'll have a closer picture of that in a little bit, but it's just all communication between neurological cells, feedback as to how healthy the environment is with connective tissue, all feedback loops. Perineural nets. So I think this is important to understand the perineural network activity along with the anatomical changes that I'll be talking about. So a lot of times I talk about the excitability and also the anatomical changes that happen in the nervous system. So the perineural nets is something that can contribute to the excitability problems that we see. These perineural nets are like a lattice of neurological tissue. So it is an extracellular matrix in and of itself, but it's a specialized component of it. It is around the body of neurons, dendrites, and axon initial segments as well. So it's around the neurological tissue. What's important to understand is that it has a lot to do with health maintenance and relaying those signals of safety in the central nervous system, so brain and spinal cord. We do see a lot of perineural network reactions that happen during neuroplasticity events. So this would actually usually during gestation or early childhood years. This is where we see a lot of perineural network activity because of the high level of communication that needs to be had, because the environment is constantly changing. So we have to learn from the environment. We have to build these pathways. So we see a lot of activity in those stages, which is appropriate. This is more expressed in the cerebral cortex, the amygdala, the striatum, and the hippocampus, and along the spinal cord itself. Okay. This is supposed to be stable and malleable. So like I said, it has to do with neuroplasticity. We see a lot of activity in younger ages, very young, infancy, and during gestation. But we shouldn't see too much activity outside of that unless the central nervous system needs help. So it's usually stable, and it becomes malleable and active to respond to something that might be considered a threat, treat it appropriately, and then come back into its stable state, malleable, right? It can be affected by certain conditions. So the perineural nets, the way that they interact and are communicating, can be affected by drug addiction, maternal hormone fluctuations, and chronic pain, as seen in the research so far. I'm sure there's other things as well, which we'll talk about in a little bit, but it just hasn't been studied as much. And we'll kind of talk about why. This is actually pretty new stuff. So the malleability is what's key, right? So the brain's extracellular matrix and the perineural networks are made to be malleable, like so much of the rest of our systems in our body, that they are dormant and they are not doing anything when they're just supposed to be stable and maintaining balance. When we need them, they turn on. When we don't need them anymore, they turn off. They need to be able to adapt to changes and respond appropriately, right? This is what allows for versatility within the function of the brain. So the ability to react appropriately and differently depending on the issue that needs to be dealt with, right? It's got lots of different responses to choose from, okay? The malleability does change with development, aging, or central nervous system pathologies, injury, irritation, and infection. And this is why it's so important within those that have connective tissue pathologies, because we are more prone to certain injuries, irritation, and infection because our barriers are not built the same, right? So our malleability can be shifted because of our inherent genetic condition, and it can be made worse if exposed to other things, right? So this dynamic activity allows for appropriate responses to a threat. Okay, it's going to return back to its baseline, become dormant. We don't need it. We'll come back to the perineural nets when we talk about pathology, because it can become dysfunctional if it's getting the wrong signals, right? But just to understand what the perineural nets are, they have a lot to do with excitability and that synaptic response. And if they are overexcitable, we see seizures. If they are inflamed in other ways, we can actually see neurodegeneration. Sounds familiar in our population, right? Okay, so when we have connective tissue issues that cause inefficiency of the brain extracellular matrix and the basement membrane, we can see problems, right? The blood components, they're not supposed to contact the astrocytes, these little cells that we'll talk about more in a little bit. But when the barrier has been broken down by injury or disease, they will make contact. And this is where we get a lot of confusion, misinformation, and inappropriate responses. It can cause cellular, molecular, and functional changes. These astrocytes, well, again, we're going to talk about these a little bit more in this and then in the second presentation as well. They can actually regress from mature, well-functioning astrocytes to immature astrocytes that don't respond appropriately, and they will re-enter the cell cycle as an immature astrocytes, promoting the continued presentation of an immature astrocyte rather than the mature ones that we used to have. So it creates this bad cycle. All right, brain barriers. It is important to understand that the blood-brain barrier is a layer that helps separate the brain, the spinal cord, and the peripheral nerves from the rest of the body. We're trying to keep the neurological tissue safe because it's really important, right? Those of us that suffer from neuroimmune responses can tell you how important this is. It really changes the status of a chronic illness. There is so much more that can be affected when it crosses the blood-brain barrier and begins to affect cognition and fatigue and things like that. So it's a very different look to a chronic illness when you have a neuroimmune response on top of dealing with other joint-related or systemic things. There are 4 major barrier systems. That's really there. You can go look all of those up, but just to, again, express that we're really not supposed to have communication between these systems outside of the cellular or the neurological communication that happens. We do not want these things, toxins and whatnot, to pass into certain tissues of the body. I talked about the glycocalyx that you could see in that little first layer of the image a few slides back. When there's damage to this first layer of the glycocalyx, it will compromise the blood-brain barrier. So, and this can break down for a number of different reasons, which we'll talk about more in some of the other ones that I present on. But when inflammation gets added and the system can't keep up with it, you will have a breakdown of that tissue itself. So you can end up with a break or a seepage or basically loose junctions in the blood-brain barrier that allows more things to get through, right? And then just a little note, because I have not gone down a full rabbit hole. For those that know me, I love rabbit holes. And this will be one of my future ones, but just to understand why we have so much cerebrospinal fluid management issues is this could actually be part of it, because one of the barrier systems communicates with or is formed by what they call ependymal or ependymal cells, which is a type of astroglia, and that can actually affect the CSF flow and production that's happening because of the signals that are being relayed to those cells. So just something to think about, that yes, working on inflammation and some of these things could actually change cerebrospinal fluid flow. So that's, again, we'll talk about this in future lectures, but just to understand, like, this is where we can make a difference. Why is somebody inflamed? We need to understand that so that we might have better outcomes with CSF leak patching or to avoid a patch altogether. Okay, so to get into the nitty-gritty of the neurology of this, of what we're talking about, so we talked about the barrier system made of connective tissue, but now let's talk a little bit about where the miscommunication can be happening. So once something gets through the barrier system, we have these cells that are supposed to be relaying messages appropriately and taking care of the neurological inflammation. Um, and sometimes they don't work like we would like them to, right? So glial cells is an umbrella term. There's different types of glial cells. We'll talk about some of them. They initially thought, and this is just a few years ago, so this is why, please understand, like this is why I have all the heavy science in here, is because this is not really commonly known. Glial cells were first thought to be just a filler inside of the brain, right? Like they don't do anything. When have we ever found a part of the body that really does nothing? So it's just kind of funny to think about. They found these glial cells that are so dense inside of the brain that they thought it was just a glue. Like that's all that it was, just structural. It doesn't do anything functional. Um, Now we realize that it's the complete opposite. So understanding the glial cell and what it's doing in an individual's presentation is going to unlock what we understand about neurodegenerative disorders and other neurological inflammatory reactions like this perineural network excitability, which we'll talk about at a later time as well with the pathologies. So we need to understand glial cells to be able to help our neurological phenotype of those that have Ehlers-Danlos syndrome or other connective tissue disorders. These glial cells, they continuously actually secrete extracellular matrix molecules, and that helps maintain the 3D structure of the matrix to keep that central nervous system balanced. So if you think about everything exists in a cycle in the body, right? So if you have an altered connective tissue structure of an extracellular matrix in the neurological system, so you have increased risk for that being broken down, and something starts to break it down more. And now you have something passing through that barrier, telling the glial cells they should be on alert and reacting to something. And that glial cell continues to cause problems with the matrix. You end up with what a lot of us end up in flare-ups, a self-perpetuating cycle of neural inflammation. The only way to get out of it is to support the connective tissue and remove the inflammatory process, which again, we'll talk about at a later time. So astrocytes and microglia are the two main mediators of the central nervous system. I'm hoping more people are starting to hear those two names, astrocytes, microglia. They're very important, right? They are the primary regulators with the wear and tear responses in the central nervous system. So damage and things like that, those cells are what respond to hopefully restore and help create like a healing environment for the individual. It doesn't always happen. They might be more active in those with altered connective tissue pathology, as the barriers might be more prone to letting things through. They're going to have more work to do if the filter system is not filtering out like it should. So then the astrocytes and the microglia are left to try to maintain the balance. And that's also not what they're really there for in this capacity. They are the communication between the central nervous system, so the brain and spinal cord, and the peripheral immune system. How important is that? So it's a neuroimmune problem for a lot of people. That's why a lot of people are doing well with low-dose naltrexone, because it works on microglia. So again, it is these astrocytes and microglia communicate between the central nervous system, our brain, and our peripheral immune system. Okay. Also, I like this quote, very important. The principal function of the astroglia is to control homeostasis of the central nervous system at all levels of organization, from molecular to the whole organ. They're important, okay? They're super important. So, sorry, lots of nerdy stuff, but just to understand what the astrocyte is, it is a fundamental part of that brain barrier. It is the most abundant cell in the brain and central nervous system out of all of the glia. Okay, it is very important. It forms the active environment of the brain and spinal cord, the active environment. So how the neurological tissue is responding to what's happening systemically around it, to injury. It's the dynamic interface between your neurological tissue and the immune inflammatory response that's happening. So important. There are a lot of different types and shapes that depends on the location and function. I'll show some little pictures of that in a little bit. And it assists with neuronal migration during development. So it's a communicator. It's telling things where to go, what it's supposed to be doing, right? It makes contact. So this is where we shouldn't have contact with certain things in neurological tissue. So the astrocytes contact the blood vessels and make connections between other astrocytes, the extracellular matrix, and oligodendrocytes, which is another type of glial cell, right? So the astrocytes are what's helping communicate, and this is important as well for those that have intracranial vascular issues that haven't worked on neurological inflammation. Your astrocytes are going to talk to your blood vessels. So if you haven't worked on neurological inflammation, it's something to think about. And this is just this last little thing is just, again, how important they are. They do so many things in the body. They help with the secretion of growth factors or neuromodulatory molecules. They work with synaptogenesis and synapse formation, synaptic pruning. So they really help clean up and maintain the neurological system. They couple blood flow to neuronal activity. So again, for people that have intracranial vascular issues, this is always something that should be checked into to see if we can make treatments better, right? And then interestingly, it's a water ion neurotransmitter homeostatic modulator. So it helps maintain the sodium, potassium, calcium, hydrogen, and it's bidirectional. So that feedback loop that happens. So you can have abnormalities within those systems that cause astrocyte dysregulation, or astrocyte dysregulation can cause issues with maintaining the homeostasis of those things like sodium, potassium, and calcium. Okay. So like we said before about the perineural networks who have a lot of activity during gestation and during infancy, astrocyte maturing will continue within the first several weeks after birth and up to the first year. So think about this. This is how the nervous system, this cell, is interpreting what's happening in the neurological environment and sending signals to different tissues around that neurological system. So blood vessels, the other neurological tissue, the immune system itself. So it's communicating with these other systems. And it does a lot of this and it matures within the first several weeks after birth and up to the first year. This is important because if during the birthing process there is premature birth or immune system challenges for the mom during pregnancy or within the first year of life for that baby, it can contribute to issues with astrocyte regulation and maturation. So, and in connective tissue aside, this is just something that we talk about with neurodevelopmental disorders and autism, things like that, ADHD, that there might be a correlation to individuals that have something happen, whether they're born prematurely or that they have some sort of immune system event that happens early on in life, might be more prone to developing neurological changes or neurodevelopmental differences later on in life. It makes sense because those astrocytes didn't have time to mature. They were put to work immediately and had difficulty communicating with the environment that it was thrust into, right? Interesting, there's also 74 autism spectrum disorder associated genes that are astrocyte biased that have to do with astrocyte activity. Interesting, right? Compared to neurons, microglia, oligodendrocytes, and endothelial cells. So there seems to be a correlation between astrocyte function and let's just say neurology, neuronal functioning, processing, things like that. Right. There's not a quiz after this, don't worry. This is where we get into, these are fun pictures though, I think. Because look, the astrocyte foot, they made it look like he has feet. So that's the astrocyte and that's the astrocyte foot, where it forms what they call the glia limitans, along with these vascular layers, extracellular endothelial tissue. This is the blood-brain barrier where it separates the central nervous system from peripheral blood circulation. So that you can see just to see the little astrocyte feet that comes down in contact with that barrier so that it can communicate with it, get feedback from how it's doing, and then receive messages bidirectional, so both ways, as to what it should be doing next. Okay. There are a ton of different inflammatory mediators that can trigger astrocyte activity. Sounds like mast cells, right? It's the same thing for the astrocyte. And this is, I'm not going through all the little figures on this picture, but just to show you, there's a lot of things that can make astrocytes unhappy, just like mast cells. But they are different. They work on the neurological connection with the immune system. It can create different problems compared to the mast cell. Okay. So with astrocytes, they produce molecules that will either heal or harm central nervous system issues. I feel like this is kind of a statement for many, many different things that happen inside the body. They can affect the structural integrity of the extracellular matrix itself, right? So it can actually, that feedback loop that I was talking about, it can eventually get into that self-perpetuating cycle of responding to a problem, but now being part of the problem and continuing to break down the extracellular matrix 3D structure. We know that with pathological conditions, there is atypical synapse formation and impaired neuronal plasticity. So we know that there is a difference with the communication in the system and how it responds to things. Interestingly, astrocytes will alter their morphology during pathological state. So they change shape. Okay, and we'll talk about that more in the talk actually about the pathologies, but just important to understand when we talk about what's developing and what people are feeling symptomatically, astrocytes change their shape, and there's not a whole lot of room in these areas and around the spinal tissue, especially with all of the things that need to be drained in and out, for those astrocytes to swell up like they do, and they do. In nearly all central nervous system pathologies, astrocytes become reactive. They will change their morphology or their structure, their molecular structure and function. And they don't do what they're supposed to do when they become pathological. So that's the important thing to understand. Astrocytes and microglia, again, this is it's really the same message over and over. That they can have a pro-inflammatory or an anti-inflammatory role, similar to mast cells. They are meant to do good, and sometimes they do not. And that's where we want to make sure that we can get out of that cycle where it turns into pro-inflammatory. There are many different contributing factors that are going to affect astrocyte activity with these feedback loops that happen with other structures. So neurons, microglia, things that get through the blood-brain barrier. There's lots of things that can happen. That's why it's important to understand the science behind it, because now you're going to have to go talk to the person or talk to your provider if you're a patient as to why are my astrocytes mad? Well, your story is going to be different than other people's. What is making your system respond how it is? What is it? And that's an individual thing to look into. All right, so astrocytes begin to attract immune and inflammatory cells to help clear infection and deal with pathology. So they talk to those mediators and different things out there, kind of again like the mast cells, to pull in things to help what it needs help with. They don't directly synthesize that perineural network, but they can help regulate the developmental function of it. So it can, the state of the astrocyte can affect the state of the perineural network and the excitability of the neurological system. Again, more on that when we talk about pathologies. These last two, it's talking just a little bit about the structure of them, to talk about little different astrocytes, just for science. Protoplasmic astrocytes may help modulate synaptic transmission, so communication, whereas fibrous astrocytes might have a more supportive or anatomical or metabolic role rather than the neuronal function. So they do different things, more support versus communication and transmission. Just depends on which one. Okay, now to the microglia. So astrocytes are really about communication, mediator response, and relaying messages, right? Microglia also assist with regulation of that homeostatic function, the extracellular matrix and the perineural network remodeling. It contributes to myelin turnover and remyelination remyelination. They are phagocytic. So they eat things, right? They help with elimination of those extracellular matrix molecules if there are too many. I like to think of them as the cleanup crew, right? Like they come in and they help kind of clean up what the astrocytes have been pushing out there. Because they are phagocytic or they eat things, they help promote a scar-free environment after injury. Much more on this in the next 2 sessions to explain scars or adhesions, arachnoiditis, tethered cord, brainstem adhesions that we see in chiari malformation. It could be an astrocyte microglia problem. For many, it actually probably is. And I should say, will need to be treated in conjunction with other things. It's not the only problem when these presentations pop up. Without them working correctly, so if the microglia aren't working correctly, there would be an increased spread of inflammation, increased tissue damage, and reduced recovery to spinal cord damage. That's out of an article. But just to understand when we're dealing with neurological presentations that we see in our population, we have to get the astrocytes and the microglia under control for people that have abnormal spinal cord movement, that we have brainstem compression, that we have tethered cord presentations. This is something that we absolutely need to make sure that we're checking in on to have a hopefully remission of whatever condition we're talking about or a significant reduction in symptoms, we would hope. During chronic systemic inflammation, neuronal dysfunction, viral or bacterial infection, healthy aging, and dementia, the microglia are primed to release pro-inflammatory cytokines. So again, you get into that feedback loop with the microglia as well, like the astrocytes, where they too can become dysfunctional because of things that are happening. They act as the immune cells of the brain. So along with the astrocytes, they can accumulate in regions of degeneration or injury and produce a wide variety of cytokines, trying to maintain homeostasis, but also pro-inflammatory. So that's what I tell people is your body's actually really trying so hard, but all of the hard work is actually producing more inflammation, and that's what we have to help it out a little bit more. When the microglia are malfunctioning, they can actually recruit lymphocytes, so immune system, from the blood to the damaged sites, still trying to maintain homeostasis. So the body really starts to pull in all of these efforts. But what we actually need to do is fix why the astrocytes and microglia are angry and then help regulate them as well. The astrocytes and microglia and their interactions with each other, how they communicate, the signals that they send back and forth, is going to dictate the health of the central nervous system, the brain and spinal cord, and how it communicates with the rest of the body, for sure. There's bidirectional crosstalk between the astrocytes and the microglia, so they talk to each other. It's not that it only sends signals one way, because they secrete these inflammatory mediators. They send the signals by releasing these mediators. So that's how they communicate is, I release this mediator, you know what I mean when I release that. But the problem is when you release too many, we don't know what was your point that you were trying to get across. There's too many mediators being released. Now I can't stop my job. And again, this self-perpetuating cycle of inflammation. Interestingly, and I'm going to get more into this in my other presentations, issue with crosstalk. So if somebody has an issue with the crosstalk of their astrocytes and microglia, this is actually found in a number of neurodegenerative diseases that are out there. Huntington's disease, Alzheimer's disease, and multiple sclerosis. Okay, so and I'm not trying to make light of the subject, but how many individuals have I come across that they swear they're getting Alzheimer's because of how their brain is operating? Or my patients that are scared with the idea of MS and they're being sent out for multiple sclerosis screenings just to find, oh, it's not that. But if we understand that maybe it's not the diagnosis in and of itself, you still might have an issue with crosstalk between the astrocytes and microglia, and you can have a world of benefit from somebody working on the astrocytes and microglia to reduce these symptoms that look like other diagnoses. Okay, so to summarize again, this was just a little bit of the anatomy background so that when in my other presentations, when I jump into pathology and then the connective tissue pathology and then treatment, we already know the anatomy and what astrocytes are and what microglia are, and that there are these communicating pieces between our neurological tissues and other tissues in that area, um, and the nervous system, and the immune system as well. So communication. Astrocytes and microglia, they work together to try to maintain homeostasis, this balance of the neurological system. And they're supposed to control neurological inflammatory responses. But just like mast cells are supposed to control systemic inflammatory responses, if we get caught in this self-perpetuating cycle of inflammation and we don't have enough help out of it, it's going to continue to spiral and feed into the problem rather than helping it. The perineural network is a structure of the brain extracellular matrix that's responsible for the excitability levels of the brain. So neuronal conduction, and the spinal cord's neurological system. And we're going to talk about that more in the pathology piece because we have a large part of our population that has neurodegenerative presentations, neuropathies, and also functional seizures. And this is related to perineural network miscommunication, let's say. There are multiple types of barriers around the neurological tissue. So we have these barrier systems that we have all little pictures for that really try to separate it out from our vascular system and our cerebral spinal fluid. We don't want our neurological tissue touching that. But if the barriers start to break down, that's where we can have these systems that aren't used to talking to each other, that are now trying to interpret things as threats and things like that. So once the barrier starts to break down, we can start to see issues. And that's where in the next couple lectures that I do, I'll talk more about the barriers breaking down and what does it and what we see and the diagnoses that we have out of that. And all of my references for anybody who wants to look any of these up. I hope somebody takes this and expands more and more. I can't stress how important understanding the neurological inflammatory piece is with our neurological phenotype of connective tissue pathologies. And I will talk more in the next couple of lectures about how this translates into basically why it's important for our population, right? So stay tuned, hang in there. Thanks for hanging in there with this science. I know it's heavy, but if you started to understand a little bit that connective tissue makes up our barrier system, and can affect communication between nervous system tissue and the rest of our body, that's a good start. All right, thanks guys.